So welcome everybody, and welcome to our Get SFU-Ready session for international graduate students. And a big congratulations on your acceptance to SFU. We are so happy that you have chosen at SFU and as part of your academic journey. And I hope your experience here exceeds your expectations. Those of you who are watching the recording, please note that the auto caption functionality may not be 100% accurate. Next slide, please, Tinder. So before we begin, I'd like to really start today's session by respectfully acknowledging that Simon Fraser University is on unceded Coast Salish territory, the traditional territories of the Musqueam, Squamish, Tsleil-Waututh, Coquitlam, and Kutchi nations. So today's agenda, we will begin to talk a little bit about the transition and intercultural programs, and we will also give you detailed information on immigration, enrollment requirements, and traveling to Canada information, and also medical insurance services and support at SFU. Once all the presentations are done, we will be also going into the Q&A in breakout rooms. So we hope to answer all the questions during the time given for Q&A. I would like to introduce you to this useful resource for new international students. So we have 5 guides tailored for different international pathways, including a specific guide for new international graduate students. It comes with a downloadable checklist, so please check out the website to access it. Next slide, please. If you're new to Vancouver or will be traveling soon, sign up for the Life in Vancouver guide to meet new people and explore the world of Vancouver living. This course is actually out in Canvas course. So the fall 2021 registration is open. And this guide will guide you through life in Vancouver and SFU. Highly recommend it. So next, quick update. Graduate student orientation is happening and will be out on Canvas as well. And Jatinder and I actually will be hosting a couple of live Q&A drop-in sessions. So if you have any remaining questions, then you can also join us there. That will be the last week of August. So having given all that updates, I'm going to pass out to Jatinder, who will be talking about ISS services, immigration, and traveling to Canada information. Jatinder, I think you need to unmute yourself first.
Sorry, that always happens. Thank you, Hannah. Hello, everyone, and welcome. My name is Jitender, and I am one of the International Student Advisor Immigration Specialist working in the International Services for Student Office, or we lovingly refer to it ISS. It's an amazing team, and we consider ourselves to be privileged to work with our talented and wonderful international students. Before diving into immigration content of this session, it would be helpful to provide you a bit of a context around what we do. So for the presentation part, I'm just going to turn off my camera to save on the bandwidth. Hannah, can you please go to the next slide?
Jatinder, you have the slide on, so can you please?
Oh, okay.
Thank you.
So at ISS, we offer a range of services to help support your transition to SFU as an international student. So you can see a list of what we offer on this slide. Essentially, we offer non-academic advising, anything to do with your temporary resident status or document as an international student in Canada. We have 5 immigration specialists who all of them are regulated Canadian immigration consultant, and we are licensed to provide advice on your study permit, visa, on and off campus, work regulation, and more. In addition, our team at ISS can offer advice on medical insurance and navigating the Canadian healthcare system, which you will hear more about later in this session. We also provide transition support and intercultural program like the ones, for example, Global Connection, etc. At ISS office also include a study abroad team who coordinate international exchange and field school. You will meet them if you decide to incorporate an additional international dimension into your studies. And last but not the least, our refugee and newcomer program engage refugee communities in a variety of ways, including research, scholarship, and support services for refugee students and community engagement. If you are looking to connect with International Student Advisor for questions about your immigration document, work eligibility, or medical insurance as an international student, you can reach us in a number of ways. So currently, we are closed for in-person services, but we are hoping to get to meet you soon in person very soon. In the meantime, we are offering advising via a number of virtual methods, including email, live chat, which is an online messaging system, phone, and drop-in or booked appointment, which we conduct via Zoom. Another great resource, and probably the first one that I would recommend you to, and Hannah also mentioned, are our welcome guides and instruction guide that are available on our website 24 hours a day, 7 days a week. So I will always recommend that these are like great resources as a first step to get your question answered. So I also included a barcode there which you can scan using your phone. You can bookmark so you can view it later. I've also included barcodes in some of the other slides throughout my presentation. So please watch out for them. That's us and that's what we do. Now, as we move into immigration section of the presentation, I will also just draw your attention to the disclaimer at the bottom corner of each slide, particularly in the context of COVID immigration policies, which can change rapidly and without notice. Therefore, the information that we are going to share today is current only as of today, August 13. So now let's get started. So I thought it would be great to share some important concepts before I dive more into immigration content of our session. We will talk about difference between visa and permits, how to maintain your status in Canada as an international student, and we will also discuss transfer students. So first of all, visa and permits are not the same thing. Temporary resident visa, or TRV, is a travel document issued to those who are coming from visa-exempt countries, for example, India or China, while electronic travel authorization, or ETA, is a travel document issued to those who are coming from visa-exempt countries, except the citizen of USA. TRV and ETA do not give you legal status in Canada. They are just travel document. These are automatically issued to you if you applied for your study permit from outside Canada and have been approved. What gives you status in Canada depends upon what kind of permit you possess, such as study permit, work permit, or visitor record. If you will be traveling to Canada for the first time for the fall 2021 term, you will receive your study or work permit at a Canadian port of entry. Your period of authorized stay in Canada is valid until your permit expires or until 90 days after you complete your program, whichever comes first. So here are a few must-know items about study permits. First, you are probably aware that you must be holding a study permit, as I also mentioned in my previous slide, for in all Canada components of your program. Application must be submitted online to Immigration, Refugee, and Citizenship Canada, or IRCC. If you've not submitted your study permit application yet, we highly encourage that you do it as soon as possible, as the processing time could be higher. Previously, IRCC committed to reduce their backlogs in processing study permits. So part of the commitment was to expedite those complete applications that were submitted on or before May 15, 2021. So this said, if you completed If you submitted a completed application by May 15, you would have received a decision on your application by August 6. So I'm assuming that most of you might have received a decision on your application by this time. However, if you submit your application after May 15, IRCC will continue to process your application and will try to process it as soon as possible. For those of you who are outside Canada currently, a study permit is not required for a period of time you are outside Canada. However, this will be needed when you are physically here, and you can only count the time spent outside Canada towards your future eligibility for post-graduation work permit if you apply for a study permit before you begin your program. So please apply for your study permit as soon as possible. So in order to maintain your status in Canada, you must ensure that your permit remains valid at all times. This means that you may need to extend or reapply for your permit if they will expire before you complete your program. We recommend that you apply for a study permit extension 3 to 4 months before your study permit expires, so as to give you enough time. If you are outside Canada, holding a study permit that has expired or will expire before your return, you must follow the process for new initial study permit application and wait for approval before you can travel back to Canada. So I just want to add, the study permit extension can only be applied from inside Canada. Among other requirements, you must provide proof of your acceptance or enrollment to SFU as part of this process. If you are a brand new SFU student, you must submit a letter of acceptance or LOA. If you have already enrolled for an upcoming term, then you should also submit a confirmation of enrollment that you can download from your GoSFU account. Now coming to the topic of transfer students, there's certain things that you need to do if you are transferring to SFU from another institute. For those already holding a study permit and are transferring to SFU, you don't need to obtain a new study permit as long as it is valid. But you would need to notify IRCC that you are changing your school, and you would need to complete an online process called the Designated Learning Institute or DLI transfer process. You can find a link to more information about this process in our welcome guide for new transfer students. If you applied for your study permit, which is still in processing, and you use document from some other institute, but now you will start your program at SFU, you must submit updated documents such as SFU letter of acceptance to IRCC before your application is approved. You can submit these documents via IRCC web form. If your application is already approved and you did not include documents from SFU, you must submit a new study permit application and wait for approval before you can travel to Canada. Now, I understand some of you might want to also have your family member when you travel to Canada. So as per the current travel restriction, immediate family member of international students who would be studying full-time at a designated learning institute, they are able to bring their family members to Canada. Please note that you can only bring your immediate family member. That would include your spouse, common law partner, and your dependent children. However, they would need to demonstrate that the travel is non-essential, is non-discretionary. For example, if a family wants to accompany you for just 2 to 3 weeks, the travel might not be considered essential. So they would need to demonstrate that they're going to come with you and they're going to establish themselves with you when they travel to Canada. So I understand that some of you might have submitted your study permit application, but you might still be waiting for the approval of your study permit application. So in that case, are you able to start your program from your home country? So in response to COVID-19, IRCC announced some flexibility for students who are studying outside that the time spent outside Canada through December 31st, 2021 will be counted towards the length of their postgraduate work permit, and you can complete up to 100% of your program from outside Canada and still maintain your eligibility to apply for the work permit. The only condition is that you must have applied for your study permit before you begin your program, and it must be eventually approved. So if you need to start your program from outside Canada, you can do this for this term if you have applied, and it will be eventually approved. It is also important to be aware of your obligation as an international student in Canada once you are here. In the next few slides, we will talk about these things to ensure that you are complying with the condition of your study permit. As a study permit holder, you're expected to comply with your study permit condition by actively pursuing your program in Canada and making reasonable progress towards completion of your program of study. From IRCC perspective, this means that you must be enrolled in each academic session during your studies in Canada. For graduate students, that means you are enrolled in each term, spring, summer, and fall. Your study permit will also allow you to legally work on and off campus under certain circumstances. To work on campus, you must be enrolled full-time at SFU in the term that you plan to work. You must check with your program advisor what does full-time means for your program. You can find a full definition about our enrollment requirement website, a barcode of which is also shown on the top of this screen. In addition, you must also hold a valid study permit, and that permit must include a condition printed on the document stating that you may work on and off campus. So as I mentioned earlier, your study, for those of you who would be traveling to Canada for the first time to start your program, your study permit would be issued at the port of entry. So you might want to verify all the information when your study permit is issued. For example, you want to check that your personal information, your name, your date of birth is correct, and that condition is printed on your document that you are able to accept employment on and off campus. So as per the IRCC definition, on-campus means that you can work at all buildings at SFU campus. As an on-campus employer can be following: school, faculty members, student organization, yourself, self-employment located on the school premises, private business, private contract that provide on-campus services to the school. To work off campus, in addition to being enrolled full-time and holding a valid study permit, you must be enrolled in a program that is at least 6 months or longer and leads to degree, diploma, or certificate. There's a limited number of hours you can work off campus. Generally, you may work no more than 20 hours per week, but you can work full-time during reading breaks, break between your semester, etc. You will also require a valid social insurance number, also known as SIN, for any work that you do in Canada. This number is used for tax purposes and is required by your employer to pay you. If you have applied for study permit outside Canada, please check the condition when it is issued at the port of entry to ensure that there's a condition that's stating that you can work, and ask for it to be added if it is not there, as I previously mentioned. If that condition is not printed on your document, you will not be able to work on and off campus. You will not be able to work off campus. If you already have a study permit without work condition and now starting your program at SFU, then you can apply to change the condition of your study permit to have those conditions added to your study permit. The process to change condition is same as process for an extension or new application if you are outside of Canada. How to apply for social insurance number? So you must have a valid study permit which is issued at the port of entry before you can apply for your SIN. Letter of introduction, which is issued when your study permit is approved outside of Canada, is not enough to apply for your SIN. You can apply for SIN in a number of ways. You can apply it online, you can apply by mail, or you can apply in person. Due to current COVID-19 restriction, you should only apply for SIN in person only if it is urgent and cannot wait. If you are outside of Canada and have been offered RA or TA position, please reach out to your respective department for further information, as you may need to submit your SIN as a requirement to start your position. If you're accepted into SFU Co-op program, you will need a valid co-op work permit to do your required co-op work terms. You can apply for a co-op work permit from inside Canada after you have been accepted to your co-op. Your SFU Co-op coordinator can give you a letter of support in the support of your application. If your program has a mandatory co-op requirement, you can apply for it along with your study permit application, and it will be approved at the same time your study permit will get approved, and it will be issued to you at the port of entry along with your study permit. Now comes the most important part. I understand that most of you would be planning to apply for postgraduate work permit once you complete your program. So as you complete your program, you may also be eligible to apply for your postgraduate work permit, and you can get a work permit up to 3 years in length, depending upon the length of your program. To be eligible for your postgraduate work permit, you must be continuously enrolled full-time throughout your program, without possible exception made in the case of part-time enrollment in final term of studies only. If receiving a postgraduate work permit is a priority for you, please make sure that you maintain a full-time status throughout your program from day one. So that was about all the information about study permit, your requirement, your obligation as study permit holder. And I do understand this might be a lot of information. So all of this information is available on our website. So you can always check our website in case you need clarification, and obviously you can always contact us if you have further questions. So now, before I begin talking about traveling to Canada, I want to inform you that SFU has a travel and self-isolation guide available on our website. The self-isolation guide is SFU approved COVID-19 readiness plan. It is a 5-part guide that will help you determine what you need to do before and after travel to Canada. Even though it's a 5 parts, I will only be explaining the first 3 parts today. Advisors are also available in case you need support in completing the required isolation plan or help in understanding and using the information in this guide. Please do not hesitate to reach out to self-isolation team at cares@sfu.ca if you need more clarification. I also want to highlight that the assessment of whether and when to travel is unique to each student and situation. I also want to recognize that given that some courses will still be offered remotely, we understand that traveling to Canada this time is a very personal decision, and it is important that you consider what is best for you in the context of all these factors. So as of last Monday, August 9th, the 3 days mandatory hotel booking requirement has been eliminated for all air travelers regardless of their vaccination status. It was already not there for who were traveling via land border. Now it has been eliminated for all of the travelers. For those who are fully vaccinated, you will be exempt from post-arrival testing unless you are randomly selected. US citizens and permanent residents of USA who have been fully vaccinated and who are coming to Canada with discretionary or non-essential reason are also eligible to travel to Canada starting August 9. while citizens of other countries would be eligible to come to Canada starting September 7, 2021, provided Canada COVID-19 situation remains favorable. Also, unfortunately, the direct flight from India that ban has been extended until September 21st, 2021. So these are the 4 vaccines that has been approved by Health Canada. So only if you have taken jabs from one of those 4 vaccines, you will be considered fully vaccinated. In case it is not approved by Health Canada, even though you might have taken those vaccines, you will be considered non-vaccinated. And you will have to follow all the process that is meant for non-vaccinated travelers. So as you are likely aware, to protect Canadians from the outbreak of COVID-19, the Canadian government has implemented some travel restrictions. These restrictions stop most non-essential travel to Canada. At this time, foreign nationals can travel to Canada only if they are eligible to do so. Therefore, we highly encourage that you check the travel regulation and restriction before you plan your travel to Canada. International students who are coming to Canada to study at an approved designated learning institute will generally have their travel considered non-discretionary. So that means they are eligible to travel to Canada. If you plan to come to Canada as an international student, you may be able to enter Canada if you have valid study permit or have been approved for a study permit and has a letter of introduction, and you are attending a designated learning institute with a COVID readiness plan that has been approved by the province, such as Simon Fraser University. So for example, if you look at these guidelines, these timeframe, so these are the proper documentation. So you need to have your study permit or approval with letter of introduction. You need to have your letter of acceptance or COE to demonstrate that you are coming to Canada to attend a fully designated learning institute and that you are enrolled full-time. You also need to have proof of financial support, and you should have valid medical examination. Also, you should be attending a DLI with approved readiness plans. SFU has been in that list since October 2020. You must ensure that you have proper medical coverage, and you must arrange for pre-departure COVID-19 testing before you travel to Canada. So even though the quarantine is not mandatory for fully vaccinated travelers, international students are still required to have a credible 14 days quarantine plan. The final determination whether you are exempted from quarantine will be made by the border service officer. If you are partial or non-vaccinated, you will need to quarantine upon your arrival in Canada. The 14-day period begins when you arrive in Canada. So I want to stress that though it may seem quite strict, the 14 days quarantine is a mandatory requirement for non-vaccinated and partial vaccinated. If you fail to quarantine, this can result in fines and even imprisonment. After you arrive in Canada, a representative of Government of Canada may call you to monitor your compliance with the mandatory quarantine or isolation. Upon arrival at the port of entry, you will be given a COVID-19 arrival test. You can pre-register for your arrival test to make the arrival process smoother. Now, this is mandatory for non-vaccinated or partial vaccinated travelers. If you are fully vaccinated, then you may randomly selected for the pre-arrival testing. For the non-vaccinated or partial vaccinated, you will also be given a test kit upon arrival, and you will need to follow the instruction to do another test on day 8 of your quarantine period. Travelers are required to remain in quarantine until they receive a negative result for the day 8 and have completed the full 14 days period. If at any point you test positive for COVID-19 after arrival, please make sure that you follow the instruction provided by the public health officials. I also want to briefly mention that SFU has a CARES program that is available for students who need to self-isolate. CARES provides you with the safe and supportive environment, meet necessary public health, self-isolation guidelines, and help you to feel part of, connected to your community. There are quite a few requirements, all related to ArriveCan, which is the Government of Canada digital tool to help travelers comply with border measure. You can download ArriveCan in your phone as well as Apple Store or Google Play. I included the logo for ArriveCan at the top of the screen. All international travelers coming to Canada are required to use ArriveCan to submit their travel information, their vaccination information before they board their flight to Canada. So we would strongly recommend that in case you're coming to Canada, please register your plan with SFU. In case you need any help, we are able to connect with you and provide necessary information and provide necessary assistance. So this is the recap of the information about the travel restriction. Here's a table that summarizes the entry requirement for your travel to Canada during COVID-19. Generally speaking, your entry requirement will depend on two factors, your date of travel and your vaccination status. If you're fully vaccinated, there are some exemptions that may apply to you, but you still must prepare a quarantine plan. If you're partially or non-vaccinated, all those entry requirements will continue to apply to you. If you are fully vaccinated, then you're only required to provide proof of pre-arrival testing that you should be taking for 72 hours prior to your test, to your date of travel. You will not be required to undergo arrival testing unless you're randomly selected for surveillance. Even though you may be exempted from 14 days quarantine and day 8 testing, you must still provide a suitable quarantine plan. If you are only partially vaccinated or unvaccinated, all those will continue to be applied to you except for the 3 days hotel stopover, which has been eliminated for all of the travelers. So these are one of the few of the helpful tips. Apply for study permit as soon as possible if you're not done so. If you are transferring to SFU from another institute, please make sure that you complete the DLI transfer process. Please monitor Government of Canada website for any updates about travel, as these information can change at any point of time without any notice. Visit our website for any resources. We have a lot of information on our website, a lot of FAQs about traveling to Canada, how to maintain your status in Canada, the instruction guide on how to apply for your study permit, co-op work permit, etc. And please connect with us for any questions. So as always, if you have any question whatsoever, you are more than welcome to reach out to us and we will do our best to help you and support you. Thank you so much. Now I will pass on the mic to our colleagues who will help you with your medical insurance related information. Thank you very much.
Thank you, Jatinder, for the detailed and informative presentation. And everyone, I understand that this is a lot of information to intake, and be assured that presentation slides and the recording will be available on our website after the session. For the next part of our presentations, we will cover medical insurance and support at SFU. I introduced myself at the beginning, but again, my name is Hannah. I'm one of the international student advisors. And here I'm joined today with Ricky from Health and Counseling and Ali from Student Care. As international students, you must have medical insurance for the entire duration of your studies. If family members are accompanying you, they should also have adequate medical insurance during their stay in Canada. In Canada, there are generally two types of insurance, primary and secondary. Next slide, please.
Primary medical insurance covers medically required services such as doctor's visits, hospital stays, and medical testing. Primary medical insurance is legally required for all residents of British Columbia, including international students. and is provided through the BC Medical Services Plan, or simply known as MSP. Secondary medical insurance generally covers extras, but are not covered by primary medical insurance, such as dental services, vision care, and prescription drugs. Eligible SFU graduate students receive secondary medical insurance through the GSS Health and Dental Plan. Next slide.
GuardMe SFU is a temporary primary medical insurance coverage. The goal of GuardMe at SFU is to help you transition while you're waiting for your BCMSP and to allow you to have immediate access to medical services in Canada. As international students at SFU, you're automatically enrolled in GuardMe SFU plan for your first term at SFU. Your coverage starts on September 1st, 2021 through till the end of December 2021. We will not be enrolling you again in subsequent terms. The cost is $281 per term, and as some of you may have already seen it reflected in your student account, it is included in your student fees. Electronic medical card will be mailed to your SFU email address at the beginning of the fall term, and you can enroll your dependent family members, such as your spouse, common law partner, and or your children in your GuardMe plan with additional cost. If you will not be physically here in Canada during the fall term, and if you anticipate late arrival, you can opt out online by September 30th by completing out-of-country opt-out form. Please note, in this case, you must ensure that you have adequate medical insurance coverage upon your return or arrival in Canada. Please contact us before your travel. If you have been living in BC and already have BCMSP, you can opt out from the beginning of the fall term until September 30th for full refund. To be eligible for a refund, you must not have used GuardMe. A partial refund is also available if you have not used GuardMe and have received your BCMSP card and request for partial refund before November 30th, 2021. And lastly, and this will be the case for many of you, if you're planning to arrive in BC physically before September 1st, please ensure that you have additional early arrival insurance through GuardMe. This will cover any medical insurance coverage until September 1st. And if you know your travel date, I would recommend you to contact GuardMe right away to arrange this. Next slide, please. The GuardMe website is actually, and to my knowledge, it's just been up this morning. So you can access all the opt-out information on GuardMe website as stated on the slide. My apologies, it's just been updated just now. So you can access it online to opt out of GuardMe if needed. Next slide, please.
BC MSP is a provincially primary medical insurance, and all students staying in BC for 6 months or longer are required to enroll under the Medicare Protection Act. Unlike GuardMe at SFU, it's not an automatic enrollment and cannot be done through SFU. If you are physically in BC and haven't done so already, please apply right away online. Or you can apply as soon as you arrive in BC. For a new BC resident, you must fulfill the wait period of 2 to 3 months to apply for MSP. Your current study permit must be valid for a period of 6 months or more. If you have any dependents, they can be added to your plan when you apply. The cost for BC MSP is $75 per month for all study permit holders. You will receive an invoice monthly by mail, and you can make online payments by mail, direct deposit, or whatever you wish. This charge does not appear on your SFU account, and you're responsible to make monthly payments. Another important thing to note is that your MSP coverage will expire with your study permit. When you renew your study permit, you will need to renew your MSP coverage as well. Normally, you would renew your study permit first and submit a copy of your renewed study permit to extend your MSP coverage. Next slide.
Regarding TSSC benefits, so if you're working for SFU as a TA or TM, you'll be applying for BCMSP in a different way. You'll be submitting your application to the Human Resources Department at SFU, and the cost will be covered under SFU Employees Benefit. These benefits are not automatic, so you need to apply, and you can enroll any dependent family members joining you in the group plan. If you're no longer a TA in the future, you must pay for your own MSP. Please note, if you are a TA, you will still be automatically enrolled in GuardMe SFU primary medical insurance plan, and you must opt out manually. SFU reimburse you a portion of GuardMe cost, and please make sure that when completing MSP group plan application form, notify the HR team that you are covered by GuardMe. For future questions, please contact the HR team or TSSU office, or also attend the medical benefit info session on TATM Day closer to September. Next slide, please.
Thank you so much, Hannah and Ricky. Hello, everyone. My name is Ali, and I'm coming to you on behalf of Student Care today to talk about your secondary health insurance. And so, as you have heard earlier from my colleagues, Hannah and Ricky, your insurance basically comes in two portions. You've got the primary health insurance provided to you by the provincial government, and you've got the secondary health insurance provided to you through your student society and Student Care, and that is what I will be talking about today. And so I know you folks are receiving a lot of new information today. So please don't worry about taking extensive notes about what I'm going to be presenting today. All this information is available on our website. You will be able to access this information anytime. We also have a dedicated line for SFU students specifically, and we've got a campus office opening up soon in September. So if you are in Canada, you will be able to visit us or call us at any time, Monday to Friday, 9 a.m. to 5 p.m. And our agents will be able to answer your questions. So I know it is a Friday evening for most of you, and you are probably excited to get your weekend started. And so I will not take much time, and I will get started with this presentation. If you have any questions, we will have a Q&A session at the end of this, at a later part of this session. And so please note them down, and we will be able to answer as many as we possibly can. And with that, we will move on to the next slide, please. So what exactly is the graduate benefit plan? As it was mentioned earlier, it's helpful to think of your medical insurance in Canada in two parts. You've got the primary health insurance, and you've got the secondary health insurance. So your primary health insurance will be provided to you by BCMSP or GuardMe. However, there are certain gaps in your primary health coverage that does not provide you with comprehensive health insurance. And so it is important to have both primary and secondary health insurance. When it comes to primary health insurance, it will cover you for things such as doctor and hospital visits, as was mentioned earlier, as well as testing and emergency medical services. However, you will not be covered for things such as vision care or dental care and other health coverage. And this is where your secondary insurance is really helpful, and it kicks in. So it's important to think of your primary and secondary insurance as going hand in hand with each other. And it's important to note that one does not necessarily replace the other. And just a quick reminder that international students are required by law to enroll into BCMSP, and this is something that the ISS can also help you out with in case you have any questions. Next slide, please. And so your coverage, your secondary health insurance coverage comes in four broad categories. There's the health, dental, vision, and travel. So when it comes to things such as needing prescription drugs, if you go to a doctor, you fall sick, and the doctor prescribed you some drugs, this is something that your health plan will cover you for. We also understand that sometimes life can get a little tough. If you're a student, school can get tough, family issues and whatnot. You have access to mental health practitioners, psychologists and counselor through your health plan. And this is quite a popular service within the health plan. So please note that this is something that you are covered for. When it comes to your dental plan as well, you're covered for up to $700 in an academic year for regular checkups, cleanings, fillings, any dental procedures that you might need to undergo. Please note that this, what you see on the screen over here is not an exhaustive list of your full coverage. I will link you to our website at the end of this presentation, and you will be able to see a comprehensive list of your coverage on our website. If you ever need to get your eyes checked, or you ever need to get new glasses or contact lenses, your vision plan will cover you for that as well. And then the travel insurance is actually a really great service that is catered for students specifically. And it comes in two parts. You've got the first part is travel insurance for academic trips. So as a student, if you are going on an academic trip that is sanctioned by your university, whether that is an exchange, a study abroad, an internship, or a field school, your travel insurance will cover you for the entire duration of your academic trip, whether that is 1 month, 1 semester, or 1 year. You will be covered for the entire duration as long as it is sanctioned by your university. And then there's non-academic trips or any vacations that you might take. And for those trips, you are covered for up to 120 days per trip. However, there are no limits on how many trips you can take in a given year. The only caveat for the travel insurance is that if you are an international student going back to your home country, your travel insurance does not apply to your home country. And the reason behind this is that many students already have health insurance provided to them by their government. And so this is something that would be redundant, and for that reason, it would not apply. Next slide, please. In case you were curious how much your extended or secondary health insurance will cost you, it costs $465, but this is an annual fee. So you do not have to worry about paying this every semester or every month. This is something that is billed automatically into your tuition fee. And so if you want to check or confirm if you are actually covered, you can look for this bill into your tuition fee statement, and you will see health and dental plan fee billed in your invoice. And a breakdown of that is here on the screen. You can see your health plan and your dental plan respectively. There's also going to be an opportunity for you to enroll any dependents into your plan for an additional cost that you will see here on the screen. And I will talk more about this in the next few slides. Next slide, please. Yeah, thank you. And so your coverage essentially begins on September 1st of this year and will go through until August 31st of the following year. So you are covered for the entire academic year. It is a one-time payment that you will be making through your tuition fee, and you do not have to worry about enrolling yourself every semester. You will automatically be covered for the entire year. Next slide, please. And so the change of coverage period is an important date for you to note for a couple of reasons. So first of all, the change of coverage period will start on August 27th until September 21st of this year. And it's an opportunity for you to do a couple of things. First of all, the change of coverage period will allow you to opt out of this plan, provided that you do have an equivalent secondary health insurance plan coverage. So let's say you are covered by your employer, or you are covered by your parent or by your spouse. As long as you have an equivalent level of secondary health insurance, you will be able to opt out of your student plan and receive a full refund of this into your tuition fee account. You will have to provide us with a proof of alternative coverage during the change of coverage period, and we will be able to facilitate this opt-out process for you. However, unfortunately, we cannot opt you out of the plan after September 21st. So this entire procedure will have to happen during the change of coverage periods, as is noted on the screen over here. The second thing that you can do during this period is combine your plans. So for instance, you already have secondary health insurance provided to you by your employer, for example. However, you think that coverage is not quite sufficient for your health needs, and you would still like to maintain your student plan. The change of coverage period is an opportunity for you to combine your employer plan and your student plan and enhance your total level of coverage. And if you have any questions about this, I will link you to our phone number, and our agents will be able to help you out very smoothly through this process. And once again, this can only happen during the change of coverage period. And last but not the least, the change of coverage period will allow you to enroll your partner and your dependents into the plan. So let's say if you have a spouse or a common law partner that you would like to add to your health insurance, you can do this during the change of coverage period. Next slide, please. And so there are a couple of ways in which you can claim any expenses that you make under this plan. Next slide, please. And the first way in which you can do that is a pay direct card. So a pay direct card is essentially a physical or a digital copy of all your insurance information, which you will be able to provide to your practitioner, and they will be able to use this information to bill the insurance company directly for the insured portion of your plan. So just as a quick example, if you go to a dentist or a pharmacist and you need to get some procedures done, or you need to get some drugs, as long as you show them a copy of your pay direct card, they will be able to note down that information and send a bill to the insurance company directly. And so you would not have to pay anything out of pocket and wait to be reimbursed later on. The second way in which you can process your claims is through our mobile app, which is available on the App Store and Google Play, whether you're an Android person or an Apple person. And so the mobile app will allow you to submit claims as easily as simply taking a picture of your receipt and uploading it into the system. It will also allow you to set up a direct deposit system so that your claims can be reimbursed directly into your bank account instead of you waiting to have to receive a check in the mail, collecting that check, going to the bank, depositing it. And so the mobile app really does make life a whole lot easier. You can submit your claim and receive a reimbursement without having to get out of your house. The next few things that mobile app allows you to do is access your travel coverage at any time in case you need to, and also access a digital copy of your pay direct card in case you lose your physical copy. And then the most traditional way of submitting claims is through online forms, which is available on our website, and all instructions on how to submit claims using this online form is also available there. Next slide, please. And so lastly, I will just briefly talk about student care networks and how those work. Next slide, please. And so a student care network is basically a group of practitioners who have partnered with us to provide you, the students, with additional savings and additional discounts so that you don't have to stretch your wallet in order to access health services. And I'm going to demonstrate this with an example in the next slide. So let's talk about an example of your dental plan. Let's say you need to go to a dentist to get either a cleaning procedure done, or you need to extract a wisdom tooth, or you need to get a filling done, whatever it may be. As you can see on the screen over here, for any preventative services or basic services or extractions, your secondary health insurance covers you for 80% of that procedure. And so as long as you go to any licensed practitioner in Canada, you will be covered for the 80% regardless, anywhere in the country, as long as they are licensed. However, if you go to a practitioner who is part of the savings network, you will get an additional 20% discount, and that will bring your total level of coverage to 100%. Even if you go to a dentist who, for instance, if you get a major restorative service or procedure, as you can see on the screen, it is not covered under your insurance portion. However, if you go to a dentist who is part of the savings network, you will still get that 20% discount and get that additional savings. And so just one important quick note, you are not mandated to go to a practitioner who is part of the savings network. If you have a practitioner that you have been going to for a long time and you prefer to continue seeing them, but they are not part of the savings network, obviously you're welcome to go to them, and you will still be covered for that 80%. However, the additional discount is only for practitioners who are part of the savings network. So I hope that helps clarify how your extended health insurance works. We'll move on to the next slide, and you can see I have included a QR code over here, which will take you directly to the homepage for your extended or secondary health insurance. I invite you to go to our website, play around and prepare yourself to see what kind of coverage you have and the level of coverage that you have for each of those categories. And as I mentioned in the beginning of this presentation, we have a direct line, a phone number for SFU graduate students specifically. And our new offices will be opening in the Student Union building at room 2301. So you can visit us in September when everyone is back to campus. And with that, I have come to the end of my presentation, and it is 9 o'clock exactly, Hannah. I am pleased to let you know. So thank you for your attention and your time.
Hi, everyone. I would like to provide a quick overview of our services at SFU Health Counselling. We have a team of doctors, psychologists, mental health nurses available to help you during your studies here. Please note that due to COVID-19, many of our services are online and we are seeing students through Zoom or telephone. If you need to see one of our providers, please call the number listed on this slide. An important fact to remember, due to medical laws, we are not able to provide any service to anyone who is not living in BC. We expect to see students in the fall in person, so that is exciting news. Next slide, please. As the transition case manager at SFU, I provide support specifically to students from international pathways and work to support them with their transition to SFU and their out of SFU, as well as when you graduate. I provide a variety of support in different areas, including mental health, culture shock, finances, understanding different systems, labor market employment information, and much more. Feel free to connect with me. I'm happy to provide any support to you. Next slide. As I first mentioned, if you are not in BC, we are not able to provide any services to you, but we have the MySP Program. This is a free mental health program available to any SFU student. You can access it even if you are not in Canada. The program is available 24 hours a day, 7 days a week. You can call the number on this slide, or you can download the app through the Google Play or Apple Store. Thank you for listening to me. I'll return it back to Hannah.
Thank you, Ricky and Ali. So now we'll move on to our question and answer session. As such, we will end the recording now. For those of you who are watching the recorded version of this session, thank you so much for watching. Welcome to SFU, and please do connect with us if you have any follow-up questions.